Hello, I'm Pauline Stolzner, and we are going to talk about cows. No, not those cows. The Clinical Opioid Withdrawal Scale, or COWS for short. The COWS is the most common tool used by clinicians to determine how significant the patient is withdrawing off of opioids. The higher the score, the more severe. There are 11 categories to the scale. Let's go through them. The pulse rate is assessed. 80 or below is worth 0 points, 81 to 100, 1 point, 101 to 120, 2 points, and a pulse greater than 120 is 4 points. For sweating, it is 0 points if the patient doesn't report any chills or flushing, 1 point if they do, 2 points for observed flushing or moistness of the face, 3 points for beads of sweat on the brow or face, and 4 points if sweat is streaming off the face. Restlessness is assessed by observing the patient. They get 0 points if they are able to sit still, 1 point if they report it is difficult to sit still but are still able to, 3 points if they are frequently shifting or moving their arms and legs, and 5 points if they are unable to sit still for more than a few seconds. Pupils are assessed by looking at a patient's eyes in room light. 0 points for normal size, 1 point for possibly larger, 2 points for moderately dilated, and 5 points for such a significant dilation that only the rim of the iris is visible. Joint and bone pain is assessed mostly subjectively. 0 points for no complaints of pain, 1 point for mild diffuse discomfort, 2 points for severe diffuse aching of the joints or muscles, and 4 points if the patient is rubbing their joints or muscles and is unable to sit still because of discomfort. Runny nose is assessed as 0 if not present, 1 point for nasal stuffiness or moist eyes, 2 points for nose running or tearing, and 4 points for nose constantly running or tears streaming down the cheeks. GI upset is scored 0 for no upset, 1 for stomach cramps, 2 for nausea or loose stools, 3 for vomiting or diarrhea, and 5 for multiple episodes of diarrhea or vomiting. For tremors, the patient is given a 0 if none are present, 1 for a tremor that can be felt but not seen, 2 for a slightly observable tremor, and 4 for gross tremor or muscle twitching. Yawning is scored as a 0 for no yawning, 1 for yawning once or twice during the assessment, 2 for 3 or more times, and 4 if yawning several times per minute. Anxiety is assessed as a 0 for none, 1 if the patient reports anxiousness or irritability, 2 for obviously irritable or anxious, and 4 if the patient is so irritable or anxious it makes participation in the assessment difficult. Lastly, check the patient's skin. If the skin is smooth, it is 0 points, 3 points for piloerection of the skin or hairs are standing up, and 5 points if prominent piloerection. Piloerection is goosebumps. A person is scored to be in mild withdrawal at 5 to 12, moderate for 15 to 24, moderately severe at 25 to 36, and in severe withdrawal with a score of more than 36. The clinician should make sure the patient is in moderate withdrawal before initiating buprenorphine naloxone to avoid causing precipitated withdrawal.